Well, I just want to thank you all so much. This is Katie Boyle speaking. I'm sharing my screen here. Just wanted to thank everyone for being here. You'll remember at our last committee meeting, we sort of talked about having some educational sessions where we could do a little bit of a deep dive into some issues. And rather than be sort of pressed for time, having guest speakers and also trying to do all of our committee business at the same time. So one of the issues that I was asked to put a session together on was the intersection of foster care and CSA. And so I'm really very thankful to welcome 4 really great experts who have been very generous with their time and here to present with us today. And so, Mr. Chairman, would you like me to go ahead and introduce our panelists?
Yes.
Okay. Well, so I'm very thankful for our experts participating here. First, I'd like to welcome Nannette Bowler. Nannette wants to say hello. I think I see her on.
There you go. Hi. Good afternoon, everyone.
Great. Thank you so much. Just a little bit about Nannette. She is the Deputy Commissioner of Human Services for the Virginia Department of Social Services, and she oversees family services, benefit programs, child care, training, and the regional offices. She's got a very long history of involvement in the child welfare system, the recipient of several national awards recognizing her great work. Prior to her current role at the state, she was the director of the Fairfax County Department of Family Services, and we worked together when I worked there. That department has a budget of $240 million and includes 1,700 employees, so it's a huge job. In a previous career, she was the chief judge of the Family Division in Michigan, where she presided over cases including guardianships, competency hearings, child abuse and neglect cases, juvenile delinquency, and adoption. She was also a member of the governor's cabinet in Michigan, where she ran the Michigan Family Independence Agency. She was executive director of an initiative at Michigan State to train social workers and law students in child advocacy. She was legal counsel and executive director of the Michigan Lieutenant Governor's Commission on Children, co-founder and executive director of a child advocacy nonprofit, and also an assistant prosecutor. So welcome, Nannette.
Thanks.
Also want to welcome Scott Reiner. Want to say hello, Scott?
Hi, everyone.
Scott Reiner, as some folks in the committee have been privileged to hear Scott speak before. He's the executive director of the Office of Children's Services, and he's had that role since June 2016. Right. He's responsible for all functions at OCS, which provides comprehensive oversight to the Children's Services Act, including training, technical assistance, financial operations, audit and compliance monitoring, IT, and outcomes evaluation. Came to OCS after 26 years with the Virginia Department of Juvenile Justice. Scott has his undergrad degree from Brandeis University and a master's degree in clinical psychology from Syracuse University. And so welcome to Scott, and thank you for being here. Also want to introduce, I think our committee members know him, but just for those who might be joining new, Andy Crawford. Want to say hello, Andy?
Hello.
Hello. And so Andy serves on our HHR steering committee. He's the director of the Bedford County Department of Social Services. He has 26 years of experience in the local government and nonprofit arenas, holds a bachelor's and a master's degree in social work from Radford University, and is a licensed clinical social worker. He currently serves as the president of the Virginia League of Social Services Executives. He's very active in his community. He's a co-facilitator for the Bedford Area Resource Council. He's a board member for Horizon Behavioral Health, Lake Christian Ministries, and the Bedford Chamber of Commerce. And so welcome to Andy, and thank you for being here. And then last but not least, Rebecca Morgan. If Rebecca wants to say hello.
Hi, everyone. Good afternoon.
And thank you so much to Rebecca for being here. She is the director of Middlesex Social Services, and she's had that role since 2012, but has worked for the agency for 10 years. Joined the social services system in 2003. Also has worked in Matthews and York Pocosin social services in various roles. She has a master's degree in community counseling, and she is the legislative committee chair for the Virginia League of Social Services Executives. And she and Andy have been a great help and resource to me in my advocacy role. So thank you all so very much for being here. I know that Nannette has offered and sort of volunteered the rest of the panel that if folks have follow-up questions, that they would be happy to field those. So you can feel free to send those to me, and I'll send them to our panelists, and we can follow up after the fact if you all have questions after you have a chance to marinate on the presentation today. So thank you all. I'm going to switch over to the presentation. So if you all will give me 1 second.
So what I mean, in essence, I would say, well, what do you want?
Oops.
So, Katie?
Mm-hmm.
Okay, so we're going to mute, but also, do you think if they have questions during the session, if they want to put them into chat, would that be okay also?
I think that would be a great idea.
Okay.
And we can sort of field those. And so let me share.
Hey, Katie, it's Rebecca. Andy sent me a quick message, and he has lost his internet connection and will be trying to get back on.
Okay.
So, Nannette, I will pinch hit for him until he returns.
Okay, thanks for letting us know, Rebecca.
All right. Well, I think we're ready when you are, and you can just tell me when to advance the slides.
Sure. So first of all, I just want to thank everybody on a Friday afternoon for taking the time to participate. And also thank you for the opportunity for us to come and speak with you today. And also all the work and commitment and passion you have to this work and the support that you're giving to local departments of social services. So today, what I've been asked to speak on is to give some background information on our foster care system. I'll touch a little bit upon the adoption system and also the Family Services Act the Family Services Act and the impact that's going to have on our whole foster care process. And Andy and I, or Rebecca and I, will be tag teaming so that when we get to certain slides, we'll be giving the state overview, but then Andy or Rebecca will be intertwining and helping give a local perspective. So thank you both for doing that. So next slide, please. So just to put a perspective of foster care, really the primary goal of our foster care program is to achieve permanency for children after they enter care. And so what that means is that we are establishing family connections and doing placement options for children in order to provide a lifetime commitment to them, give them a sense of belonging, and a legal and social status that'll go well beyond our temporary foster care placements. Next slide. Thank you. So this slide includes our permanency strategies from our Child and Family Services Plan, and that plan is a 5-year strategic plan that really drives our system to better outcomes. So you'll see on this chart that currently our permanency team is prioritizing in the following areas. Implementation of data-driven statewide foster parent recruitment plan. And what we mean by that is we know as a state and through our jurisdictions that we do not have enough foster care parents. But even more on point is that when we recruit, we are going to start looking at our data. And as we start recruiting foster care families, we are going to then target and mirror up what's the needs of the children that we're seeing, the type of children that we're seeing, and then do what we call targeted foster care recruitment. So we're really matching the children with families so that we're using our data to do so. We're also very, very wedded to improving and increasing the use of our relative placements, and I'll get into that a little bit further in the presentation. We're looking at decreasing the use of congregate care placements, and we're doing that through a case review process. Again, looking at data, who are the children in congregate places? Are they appropriately placed there, or have they been placed there by default? We know that congregate care is not the optimum for children, that they need to be in families. So we're really on a drive to decrease our congregate care placements. We're also looking by doing a collaboration with our court improvement program and making revisions to our policies towards looking at timeliness of permanency through basically 3 avenues: our reunification, meaning going back to the parents; doing relative custody transfer where that's not possible to be back with the parents; and also looking at adoption. These are our year's action items, which the strategies that we're going to be implementing. So next slide. Okay, now we get into our foster care. So I thought I would give some background information on how our children enter foster care, the different ways that they will come into the system. So currently right now we have 5,400, this is statewide, children in care. 4,600 of them are between the ages of 0 and 17. And approximately 800 are 18 and over, and that's our Fostering Futures program, which I will explain a little bit further into the slides. So there are various ways that our children come into care. The entry through the abuse and neglect system is the most prevalent in emergency situations where we have to come in and remove the children and then go to court, or the agency can go to the court first and then remove the child. So if there's an emergency, we remove the child, we then go to the court afterwards. Otherwise, we go to the court first upon finding abuse or neglect. And in 2019, we had approximately 78% of our children enter care from abuse and neglect petitions. The next category we have is CHINs, and that is children in need of supervision. And these are usually our truancy cases or AWOL or runaway situations that happen from time to time, unfortunately. And approximately 3% of the children enter care after there's a determination through that process that the child or youth is in need of supervision. Another way that they come into the CHINs is our court actions that address where children are in need of treatment or residential placement. And approximately 6% of our children entering in care in 2019 came in through the services through a judicial determination that a treatment or residential placement was needed. Another area is delinquency, and that's when a youth has a criminal charge and then has been found delinquent. And then approximately 3% of our children enter through the delinquency process. There are also voluntary methods of entry as well. And that is when we have entrustments or when parents come and seek relief of custody petitions, when they voluntarily place the child in care, either temporarily or permanently. And approximately 3% entered through our entrustment and 6% through our relief of custody. In our non-custodial foster care, that's when a parent or legal guardian retains legal custody of the child. So they maintain the legal custody of the child, but place the child in physical custody for us. And these agreements are typically so that the parent is able to access residential treatment. And we have less than 1% that enter through that route. So we work really hard to keep children and youth out of foster care. And Virginia is one of the lowest, has one of the lowest rates of entry per capita in the country. Additionally, children can enter under the age of 18, can re-enter foster care when they've been discharged from foster care to custody by the Department of Juvenile Justice and are released prior to their 18th birthday. So Fostering Futures, again, what I'll speak about here in a moment, is our voluntary extended foster care program. And that's for youth that ages 18 to 21 who have aged out of the foster care system. And that's one of the areas that we're fervently looking at. When we take children into care, they should be better off than when they entered. And we are really cognizant of the children that are actually aging out of the system. So we're trying to work on changing the trajectory of that. But the purpose of that program is to provide supports. And in calendar year 2019, 403 youth entered the Fostering Futures program. Next slide. So this slide was provided to us. We are in partnership with the Casey Family Programs, and they are working with us on permanency for children. And they did an analysis for us to see where our children are overrepresented relative to the proportion in the base population. And they looked at different decision points across the child welfare system. And as you can see from the first bar of the child population, the Black and African American children represent 21% of the overall child population. And that's something that is not unique, unfortunately, to just Virginia, but nationwide. And then as you can see, the blue area keeps getting bigger, and this is showing that Black African American children are overrepresented throughout the child welfare system. And the last four bars represent points in the foster care system, and that's what's in the yellow circle. And the Black and African American youth and children have a higher rate of being in foster care for 2+ years, and in our children aging out of the system. Next slide. So here we're looking at that foster care, as we said, is meant to be a temporary solution. And that's one of our core tenets of our Virginia Children's Practice Model, is that we believe that children do best when raised with their families. And we're making every effort to help the children remain with their families, including exploring use of relative placement options. And so entering, we know, into a child welfare system is a traumatic experience for these children. And so we look for when they can be safely placed with family members so that we can reduce the trauma they experience. And in addition, we are also, while children are in care, making sure to offer a full range of casework and treatment services. And these services are provided to the families as well. Next slide. So here's where I'm going to cover the types of placement that we have when we have children in foster care. And there are multiple placement options for youth in the foster care system. The majority, and we're trying to change the trajectory of this at this point, our children, you can see it's by the orange part of the pie, are placed in non-relative foster homes. And you see it says 64.8%. As part of our VDSS efforts to move to a kin-first culture, one of our priorities is to increase the number of kinship foster placements. These placements are when children are placed with relatives or fictive kin that go through a foster care home process to be a placement for the children and youth. And fictive kin, by that what we mean is they have a very close relationship with the child or the family, so that it feels like their family when technically they're not a relative. And sometimes it's godparents, a close neighbor. When I was representing children in the foster care system, we even had teachers that came forth to help foster the child. So that's what we call our fictive kin. There also for placement is the congregate care placements, and that includes what we call group homes and residential facilities. Then there are independent living placements, and that's when a youth lives on their own. That can be such as a dorm or an apartment, or lives in a supervised independent living program. And that's where we have an apartment style program, but youth are there that are requiring extra support and supervision. We also have trial home visits when the local departments place the child in their parent or parent custody's home on a trial basis. So before we return them, before recommending to the court to return custody. So we do a trial run to see how the reunification will be. And then now Andy is going to, if Andy's back, are you back, Andy?
Back.
Okay, and then you're going to need to speak loud.
Yes,
So,
ma'am.
okay, so Andy's now going to talk to you about how much work goes into finding appropriate placements for our youth and children.
Thank you, Nannette. Yes, the amount of work that goes into finding a placement for a foster child can be quite onerous. Recently, we had a child whose placement disrupted, and the worker calculated that it took her 25 work hours to make the appropriate referrals and finding a placement for that child. So what we find is, first of all, you have to rule out if there is family and if the family is appropriate, if you can place with them. And then if that works, that's great. But then you have to rule out foster homes. If your agency does not have enough foster homes or a foster home that can take the child that you're trying to place, then of course you have to look at private agencies, which we call therapeutic foster care, or TFC. And then sometimes while you're doing all of that, you may have a child with different high-level needs where you have to look at residential placements. And so you may be making referrals to your own foster homes, to private foster homes, residential facilities, all at the same time. And it can take a lot of work. What we're working on at the league and with the state is how to figure out how to streamline the application process to where the worker does not have to fill out a different application for each placement that they contact. So in Bedford County, where I am, we can refer to over 30 different private foster care agencies across the state. And there are times in an emergency situation where we've actually had to place a child in Virginia Beach on a Friday night, because that was the closest placement we could find for that child at the time. So it's just really an interesting process for locals to think about how much time it takes to place kids into the appropriate placement, sometimes in a short period of time.
Thank you, Andy. And that's why we're emphasizing, and we're starting a whole new diligent recruitment plan so that we are increasing the number of foster and kin placements in communities. So as Andy's described, we're not having to transfer a child out of their community when they are taken into care. Andy, I believe this is where you're going to discuss the complexity of case management when children are in foster care.
Thanks. I changed my speaker configuration, so I hope that helps.
Yes.
Okay, great. So, yes, when you look at the next slide, please.
It's not, we're on it, Andy. Oh, there we go. Okay.
Sorry. All right.
No, okay.
I think it was just slow getting to Bedford.
Yeah.
So when you look at the complexity of the foster system, you may actually have one child in foster care, but that child is connected to all of those bubbles on your screen. So it's not just one child in foster care. You have to work with the CSA office. You have to make sure that you're dealing with the court appropriately. You have fictive kin that you may be working with. You have medical providers, foster parents, behavioral health, counseling, and then teachers and folks at the school. So when a foster care worker gets a case, there can be as many as 10 to 12 people on a team that surrounds that child. And so what we do in Bedford is we create a distribution list where every person is on an email distribution list, and you communicate with everybody with one email to keep down on the communication messes that you can have while you have so many people involved. Because if you're not careful, you can have some triangulation and some fact inconsistencies. So foster care workers have to deal with a huge number of people on each case.
Thank you, Andy. Next slide, please. So this is covering the types of services or some examples of foster care services, and they include safety services, and that's to address specific safety needs of children while they're in care. And that could be a service related to safety, or it could be something concrete. So, for example, a safety service may be where we're purchasing child safety locks for a foster parent to ensure child safety. We also provide what we call permanency services, and that can range from anything such as reunification services, where we're helping and working with the family, providing things like parent coaching, family therapy, any type of support services they need, and then also making sure that we're ensuring family time. And that means that we're looking to provide consistent, frequent, face-to-face time, because we know that that's a key factor in supporting successful and timely reunification, as well as supporting the child's mental and emotional health. A key example of some of our well-being services is our educational stability strategies. So it's important that when children or youth in foster care, when they're placed, that they're able to stay within their community and maintain the stability in their school placements, and so that they can still stay connected with extended relationships, have a sense of normalcy, and then remove any barriers to their academic success. So we work with the schools very closely, having what we call best interest hearing, to make sure that we are going to all lengths to keep that child as much as possible in the school system from which there is of their origin. And sometimes, though, we have children that experience multiple foster care placements and then multiple school placements. And if that happens, then we're cutting them off of their community and sometimes putting them behind in their education. So we're partnering with the Department of Education to make sure that we're looking at creating educational stability strategies and opportunities for children to remain in their school of origin. Next slide, please. Pardon me. So again, here's the permanency goal. So when children enter foster care, we develop what we call a foster care case plan. And that establishes a goal where the agency and the family are working together towards that child being reunified with their family. And the plan is then filed with the court, which approves or disapproves or modifies that plan. And then that plan is what the court continuously looks at and reviews through regular court hearings to see what progress is being made on achieving the goals of that plan for that child to be returned home. There are 3 permanency goals, as I spoke earlier: reunification, meaning the child goes back to the family, where we transfer custody, legal custody, to the relative, and that can be with or without financial assistance. And then, of course, the adoption. And so these are considered permanency because they establish permanency for the child, but there are 3 other goals that do not establish permanency. And the goals of permanent, and those are the goals of permanent foster care or another planned permanent arrangement, where the child, if they're older than 16 years old, enters into an agreement saying they want to be in permanent foster care placement. They don't want to have their rights terminated or go into adoption. And then there's also what we call independent living, and that again is where we have fostering futures youth ages 18 to 21 who are living on their own. Next slide, please. So this is showing you exits from foster care and in permanency and where our children are going in achieving the permanency goals. And one of, so you see here that there's 27.9% are reunited, 16.1% are transferred into relative care, 31.5% is adoption, and then we have youth that are being emancipated. And one of our top priorities, as I indicated before, is to decrease the number of youth that are being discharged to emancipation and increase the number of youth exiting to permanency. Next slide, please. So here again is our fostering futures that I've spoken about. And this is extended foster care program for youth who have aged out of the foster care system. And they are participating, they voluntarily enter into the program so that, and when they meet one or more of the eligible, to be eligible for the program. And that provides a safety net for these youth through an extension of foster care services, including placement. And Andy, if you would please talk about why fostering futures is really a good thing, but also why it requires a lot of work from the local perspective.
Yes, so from the local perspective, this is a really good thing for our kids to have the additional support they need after they turn age 18. However, what we didn't realize in the process of all the changes is how much case management these children would actually need. They, if you think about, if you have your own kids and 18 years old to 21, how often they may call you and they have good resources and they can actually cope with some life events. And then you take kids from foster care who may not have those resources and those coping skills. So the case management time on these cases can be a little higher than the cases with kids who are placed in foster homes who have foster parents who can answer those questions and offer that support. So it is a little bit heavier there. One thing locals are also noticing is that when this service first came out, we thought it would be more federal funded, and it is heavily federally funded. However, some of these kids do work, and it does throw them into CSA funded pots of money. So if you're on the local board and you're pay attention to CSA, you may see some fostering futures expenses in those line items.
Thank you, Andy. Next slide. So our resource families are families that include kinship, foster, and adoptive families. So they're dually approved to be foster and adoptive families in foster care in Virginia. And the families are relatives or individuals who maintain a relationship with the child's family and the child prior to entering into foster care. And approval for the kinship families is prioritized at the time of entry of the children into foster care. So our foster and adoptive families are either approved by local departments or private licensed child placing agencies. And whether in families approved by the local or by the licensed child placing agencies, it is important that children in foster care, again, are placed with their communities. Our resource families have a really important role in supporting the children and families, and they're very much pivotal in ensuring that child and family parents are connected and play a critical role in family reunification. So next slide. So we know, just a moment. So by prioritizing family connections and promoting connectedness, we're empowering families to develop supportive relationships that facilitates sustainable change. So we should never make decisions about lives of children and their families without those who love and care about them and who are involved. So families understand each other and the dynamics of the relationships, some of which we cannot. So in Virginia, our kin first culture, and this is something that we are very wedded to, is we begin at yes. We are aware that there's preconceived notions about families we serve that lead to biasness and serve as barriers to ensuring that adults who are important to them maintain connections. We've heard it from time to time, for example, which is not accurate. The apple doesn't fall far from the tree. But what we're doing through our family partnership meetings is prior to a child being placed in foster care, we have what we call a family partnership meeting where the family can bring anyone, including friends and their families, and then they are part of the process of assisting us in placing that child, if possible and safely, with a kinship family. So we're really focusing on our development and our policies, on practicing and promoting this, and to ensure that we're giving the best opportunity for children to remain with their relatives. So Andy, if you could talk about the additional support that the relative families need when the children are initially placed with them.
Sure, I'll be happy to. What we have found with kinship care is that the families have a higher level of stress because they are taking care of family members. So if you think about the fact that you take in your brother's children and your brother must be struggling with some problem, and you have rules set by the Department of Social Services about how often you let your brother see his kids, or your brother shows up at your house when he's not supposed to see his kids. And then there's like your mom's calling you to complain about your brother or to complain that you're keeping your brother's kids away from you. So it adds a whole level of stress to families that you may not really think about unless you've experienced it. So those cases take a lot of casework support to make sure that the kin families feel supported and understand the rules, because it's when you have a child in foster care, the family does not know the foster family and they typically don't call or stop by the foster home. But in kinship care, that can happen. And so think about holidays, Thanksgiving, Christmas, where you normally have families all come together, and then the stress that it may put them under if they have different rules they have to follow at that time. And then you also have the fact that families have to grieve loss, because a lot of these cases, children have been abused or parents have been addicted to substances. So they're also having to grieve the fact that people have misbehaved or have addiction or other mental health issues that are also stressful to the family system. So that takes a little bit additional work.
Right. And so when I was director of Fairfax County and our foster care numbers were going down, we actually were able to repurpose the staff and created a kinship care unit so that we could provide that type of support for the kin providers. And also we called in experts who were experts in the area of kin placements to help do trainings and supports for kin providers, because it is, as Andy's saying, a totally different dynamic. Next slide, please. So Andy, you're going to cover the Casey data on placements for the entire state, the impact on the local budgets.
Yes. So our data does show that kinship care has increased over the last year, and it's a slight increase, but it's a good increase. And how that impacts our local budgets is that actually can save your localities money. So when you're placing children with family members, while you still may approve them as a foster parent, the child may not be in an expensive private TFC agency or in one of your own homes. So it does free up your own foster care system and your own services and resources, and allows the kids to actually be in their home. Another way to look at that, though, is you may see kids who have to come into foster care who normally may not would have, or they would have been placed with another agency or another foster home, and then their family is approved as a foster parent. So what we hope we see is an increase in family foster care, where family members are becoming foster parents for their family members. That would be a really great thing, and we have seen that happen, and we've seen some really good outcomes from that.
Thank you, Andy. Next slide. So what we're talking about here, this discussion's about resource families and children having family-based placements, and that's one of our focus and shifts. And so through the Family First Prevention Services Act, this slide is giving you an overview of our child welfare funding in 2019 on foster care and prevention services. And as you can see, it's a little lopsided. We're spending about $353 million in foster care services, significantly more than our prevention services. And as we indicated, we know how traumatic it can be for a child to be separated, and also the impact it has on the state and local budgets. So to support a child in foster care, we spend almost $47,000 supporting a child in foster care each year. Now, conversely, if we're looking at prevention spending, we spend currently a fraction compared to what we're spending in foster care. And we know that prevention services will help reduce additional trauma, and we know that it will also strengthen the families and the communities. Yet our child welfare system does not show that we value prevention, at least from a funding perspective. Let's put it that way. So prevention services, of course, it's the right thing to do. It's far less costly than our foster care, and their children are more likely to remain in their home and in their families. So there's some things going on. We've done a tremendous job of reducing the number of children in foster care and in costly congregate care over the last decade, but we're working on still improving that. So as we align our in-home practice with the family first and the ability to draw down federal funding from prevention services, we're hoping to shift the practice. So what we're doing and what the Families First Prevention Act is about is taking the Title IV dollars that are currently invested in foster care and pushing those monies up the pike so that we can provide better services for families, including in-home services, mental health, substance abuse, and also evidence-based practices too. So let me go to the next slide. So we know that, and I touched upon this just a moment ago, that Families First is incentivizing prevention services by providing federal funding for prevention. So Families First is also, in addition to providing more services at the front end, is also there to disincentivize placement of youth, of children into our congregate settings. And that's by reducing the type of placements that are eligible for Title IV funding. So what has happened is you've got the Families First Prevention Act at two ends of the continuum. At the front end, we're wanting to shift those funds and provide more upfront services to families to keep them intact. At the back end, we're talking about reducing children in congregate care. And so the premise of that is that youth should only be placed in congregate care settings if there's a clear treatment need and they cannot be met in the community. So we have been focusing again on reducing the foster care and have seen 60 youth step down from congregate care to family homes and community support. So as of July 21st, we have what we call our QRTPs, or Quality Residential Treatment Programs. And that is going to have an immediate impact of the law through a shift of taking Title IV funding from our congregate care placements. So we anticipate that the shift will affect funding streams, including Medicaid, local, and CSA budgets. So if children are not, here's what's going to happen. If they are not being placed in a facility that has been qualified as a qualified residential treatment program, then what will happen is the youth that are placed in residential facilities will not receive Title IV dollars. So over the next several months, we're going to be providing additional information on those requirements and the funding requirements. Let's cut right to the chase here. What this means is when this comes into effect as of July 2021, if a youth is not placed in one of the QRTPs, federal funds will no longer cover it. And therefore, there will be a shift in paying for those congregate care placements to CSA, a shift to Medicaid funding, and the local match. There will have to be a local match to the CSA and a local match to the Medicaid. So that's the impact this will have in the future. Next slide, please. So just real briefly, when an agency determines that parents or relatives are unable or unwilling to have a safe, permanent home for a child that will meet their needs, we then consider the appropriateness of adoption. Next slide, please. Here, this slide shows the number of finalized adoptions over the past 5 years. Our goal has been to hit the mark of 1,000. This year was the second highest number of adoptions we've done. The increase was seen in 2017, and that was impacted by the assistance of adoption negotiators. But we're staying right in the trajectory of mid to upper 800s on this. And then the next slide, please. Oh, I'm sorry, Andy. You're going to talk about the number of children that are available for adoption by region.
Yes, thanks. So this slide shows how many kids are free for adoption by region. So as you can see, in Central Region, we have 127, Eastern, 98, Northern, 136, Piedmont, 236, and Western, 103. The problem we have here is that when a child is not placed with a foster family who is willing to adopt, the worker has to find a family that can care for the child and then do a process where you transition the child to the adoptive home. Oftentimes, kids are placed in congregate care or residential facilities, and their needs are a little bit more, I call them higher octane kids. So they take a little bit more effort on behalf of the family. So those kids are harder to find placements for. We have had luck in placing some of our really difficult kids with adoptive families. We have one in Fairfax right now who's doing really, really great after 4 years of looking for an adoptive home for. So sometimes it takes them a little bit more time than what the feds would like for it to take to find a good placement, but it can be done. But it can be stressful, especially for younger kids who are in residential placements. It's harder for families to visit. It's harder for kids to feel acclimated into the family home. And so it is a struggle. So we are working diligently to decrease those numbers every day.
Thank you, Andy.
I'll let Nannette talk about family first a little bit.
Okay, so just as a recap of changes to foster care and the focus on prevention. So we have 5 strategic priorities that are guiding our implementation of the Families First Prevention Act. We're going to do prevention services that target resources and services to prevent foster care placements. Also, family-based placements, we're again going to be focusing on a kin-first culture and diligent recruitment, meaning targeted to improve the amount of foster families we have, but actually not just any foster family, but families that line up with the type of children that are coming into care in that community. We're going to be providing evidence-based services that'll be funded through the Title IV funding to preserve families, and I spoke about those previously. We're also looking to reduce our congregate care placements by ensuring that the setting and services meet the youth's needs. And then we are also going to assure resource and fiscal accountability so that we're building capacity and leveraging our resources. And before I pass it on to Scott to talk about CSA and foster care, I just wanted to say, Katie, that we would be happy to provide this slide presentation for distribution if you would like. Okay, and Scott, it's now you're up.
Thank you. Can you hear me?
Yes.
Thumbs up. Yeah, good. Thank you, Nannette. And I'm going to pop on my camera here and say good afternoon. And I'm glad to be with you today, along with my colleagues from the Department of Social Services. My goal today is to share with you some basic information about the Children's Services Act, or CSA, how it's so closely interrelated with Virginia's child welfare system, and to do that before the VACO virtual happy hour begins at 5 o'clock. Right? I knew I'd get a chuckle out of that. So let me see the next slide, please, Katie, or Jeremy. Thanks. So the CSA is a unique, and some might say one-of-a-kind program in the country. It was created through landmark legislation and is now in its 27th year of operation. It was developed out of a belief that Virginia could do a better job of meeting the needs of its children and families who face significant challenges in various areas, including school, home and family, and the broader community. And it's a program that, while initially weighing in at around $78 million of combined state and local funding, in the most recent year grew to a program serving over 15,000 youth and families and accounting for over $438 million in state and local funding. So I'm going to just let that number sink in for a minute. Where I come from, they have a saying that sounds starting to sound like real money. So it's a very program with a very big footprint. The CSA legislation of 1993 and its evolution over the past quarter century created the administrative and financial structures that guide its functioning. These include, like the DSS, a state supervised, locally administered and operated model, and state structures, specifically the State Executive Council for Children's Services and the Office of Children's Services, where I have the privilege of being the director, that provide oversight and guidance in accordance with their respective statutory responsibilities. And our local entities, the Community Policy and Management and Family Assessment and Planning teams, that provide local operations and oversight in accordance with their respective statutory responsibilities. And I'll address those roles in a bit more detail in a minute. On this next slide, you know that I mentioned that the founders of CSA, and without exaggeration, it was a literal cast of thousands, state and local government leaders from both the executive and legislative branches, advocacy groups and families, service providers, had as their goal a more effective approach to serving children and families. This approach is reflected in the foundational section of the CSA itself, found in Section 2.2, 5200 of the Code of Virginia, where the CSA mission is reflected in the words on this slide. This mission is firmly grounded in what we know as a system of care philosophy, which emphasizes collaboration between state and local governments, between the various child-serving agencies at both the state and local levels, between public and private service providers, and between the program and the families and children it serves. The concepts of being child-centered, family-focused, and community-based serve as our North Star, guiding the principles in developing and delivering the program. You'll see on the next slide a little bit more detail about this issue of a state-supervised, locally administered system. And it was wisely designed this way because that approach to organization wisely recognizes that the available resources, which include both services and budgets, the needs of children and families, and the values of all localities across the Commonwealth are not the same. While providing sufficient structure and oversight to assure some consistency, the CSA was designed to allow for local flexibility in its operations. So, you know, you've heard the saying, if you've seen one, you've seen them all. Well, in CSA, of which there are actually 130 distinct local programs, if you've seen one, you've seen one. And that's probably a bit of an exaggeration because there is a great deal of consistency. But the model does allow for local self-determination and flexibility. Of course, some might say there is too much flexibility and not enough consistency, and others might say there's not enough flexibility and too much state control. Where you and your individual localities and your boards of supervisors fall on that dimension, I'll leave that for a discussion on another day. On the next slide, I'm going to briefly talk with you about the state supervised part of CSA and the relevant state and local roles and structures. In addition to the requirements of the code, which is inclusive of those requirements found in the Appropriation Act, governance of the CSA is assigned to the State Executive Council for Children's Services. Membership on the SEC includes 21 folks, state agency directors, 2 parents, 2 service providers, representatives from the judicial branch, and of particular interest to you, 5 appointments by the governor of elected and professional staff of cities and counties. So we have both elected board of supervisors members, an elected mayor, and then a couple of county administrators, all of whom have an equal voice on the SEC. And the SEC has an array of assigned responsibilities, which are summarized on the slide and include financial and policy, programmatic development, oversight, and unfortunately, when localities are determined to be out of compliance with the requirements of the Act, occasionally that results in a denial of state reimbursement and funding. On the next slide, you'll see what my office does. The Office of Children's Services, which is the operational agency within the state government, responsible for facilitating the activities of the Act and overseeing overall compliance with state law and the policies of the SEC. Our activities fall under 6 broad categories, all required or supported by the code or SEC policy, and you can see them summarized there on the slide. On the local end, as you see on the next slide, the program is actualized through the oversight activities of the Community Policy and Management Team, which is established by code and has 18 enumerated powers and duties falling under 3 broad categories, and kind of in a way parallel to the state oversight structures: policy and planning, fiscal and programmatic management, and data collection and reporting. Next, please. Oh, no, that's fine. The CPMT consists of statutorily required members, which include an elected or appointed official. So this is where you'll either have a member of the local board of supervisors in some cases, or more often an assistant or assistant county administrator or county administrator are required to serve on the CPMT. And it's the agency heads or their designees from the other child serving agencies. And importantly, and I've highlighted here, that includes the local department head from the Department of Social Services. So Andy and or Rebecca or their colleagues or one of their designees serve on the team. Next, please. I like to call the FAPT, or Family Assessment and Planning Team, as the place where the rubber meets the road in CSA. Each locality has one or more teams, with some localities having multiple teams, with at least almost every day of the week to meet the demand. FAPT is where children and families are determined to be eligible for CSA-funded services, where assessment information is gathered and reviewed, where families and youth are engaged, remembering that child-centered, family-focused mission that I shared with you earlier, where needs are identified and service plans to meet those needs are created, and where those services are then monitored, reviewed, and adjusted over time. On the next slide, you see those who are required to serve on the Family Assessment and Planning Team, and it's many of the same groups that you see on the Community Policy and Management Team, usually at a lower level in the organization, but it also includes representatives from parents so that the voice of those being served is well represented. Typically a provider of services to emphasize that collaboration. And good practice at the FAP level typically means that parents and their guardians participate in the FAP process for their child, either through the FAP process itself or in a parallel process to the Department of Social Services Family Partnership meetings. If you can move ahead for me. So I'd like to now shift from the structural and programmatic aspects of the CSA to the financial ones. The growing costs of CSA at both the state and local level are among the biggest, if not the biggest area of concern for those responsible for budgets. So that would be at the state level, the General Assembly and the governor. At the local level, typically the Board of Supervisors or City Council. The fiscal structure of the CSA was created through what's called establishing the State Pool of Funds. The State Pool established through the Appropriation Act how services are to be paid for. The pool was originally created by blending or merging funds that were in 7 distinct funding streams across the 4 major child-serving agencies. Once these funds came into the pool, they no longer existed as discrete budget lines in those agencies and are totally under the management of the Act and operationally under my office's responsibility. The state pool is responsible for providing reimbursement to local governments for a portion of the costs of providing the required services to children and families who are defined as statutorily eligible for those services in the CSA. If you're interested, the specific language which requires local funding support, because I occasionally do get a question from a local government, is, do we have to put in our share? And I always say, well, you don't have to, but then you wouldn't get any state money, which isn't usually a good trade-off. But in reality, the language in the code in 2.250-11 states specifically that it establishes the state pool. And I'll quote it for you. It says, the General Assembly and the local governing body shall, and you know what shall means, shall appropriate such sums as shall be sufficient to provide special education and foster care services. And it goes on. But what it does is it defines both the state and the local government's responsibility to provide certain services at whatever the cost they may be. As the number of children in foster care increases and the costs associated with them increase, or as the number of children receiving private special education services increase and their costs increase, both the state and the local government are obligated to fund their share. So it's unlike many other programs in government that are limited by a budget. And the budget says you have $1 million, and if in the last month of the fiscal year you have run out of that money, you can't, everybody goes home on furlough. You can't buy copy paper. CSA is not like that. CSA is a sum sufficiently funded program, which means the needs and costs of those needs for certain children drive the actual budget. And that creates some challenges at both the state and very often at the local government, which has smaller ability to raise funds or a much smaller budget within which to move funds. And so, we're well aware that the increasing cost of services that are under the CSA present unique challenges and stresses to local government. If you can show me the next slide, please. So when the CSA funding streams came into the state pool all those years ago, almost all of them had somebody's got an echo on. Thank you. Almost all of them, and really the overwhelming majority of those funds, already came with an associated local match. Specifically, the special education funds had a local match that was tied to the composite index. And the foster care funds had a comparable match, so that the matching requirements that CSA presents are not new to CSA. They were there before. Of course, not a lot of people have been around long enough to remember that and see it as simply, oh, this is a CSA cost requirement. Well, in fact, if CSA were to be rescinded tomorrow and we were to go back to the pre-CSA model of funding, those local matches, maybe not at the exact rates, because localities' composite indexes vary a bit from the CSA match rate. So in that equation, there would be localities that would be winners and losers when you compare composite index to CSA. But the local obligations to fund these, again, these kind of statutorily required services would not go away. That shared responsibility, as I said, was carried forward into the CSA. And the Appropriation Act specifies that all the localities are required to appropriate a local match for the CSA state dollars. Each locality has an established match rate, base match rate, which varies. But overall, that's every dollar that's spent on children's services through CSA, 65% of that dollar is provided through the state, through its reimbursement to localities, and 35% is provided by the local matching share. Those local matches range from a high of 53%, in which case the locality is actually paying a little more than half, and to a low of 17%, where the state is paying 83 cents on a dollar. So depending on where you sit, the saying goes, your mileage may vary. Additionally, beginning in 2009, and depending on the service being funded, those base match rates may be decreased by up to 50% for those services provided to children and their families in the community, or increased by 25% for those children served in residential placements. The intention was to create incentives for serving kids closer to home in line with our mission. Foster care services are almost always entirely matched at the base community match rate. The next slide, please. So you may ask, what is all this money, $438 million, getting spent on? So the pie chart on the right, and I haven't had a chance to get this up to date for 2020, but it's close. Percentages are pretty close. That the largest group of children served, almost 2/3 of them, which are that blue section of the pie, were eligible for CSA due to their receiving foster care services, the group of children we're here talking about today. The second largest group, at about 1/4, is the orange, were those students receiving private educational placements due to their educational disabilities. The chart on the left, as you can see, looks a little different. The chart on the left reflects that while only accounting for 25% of the referrals, 26%, costs for private educational placements accounted for almost half of the total expenditures. This is a reflection of the typically higher cost per child for these educational services than for foster care or really any other service funded through CSA. These geometrically growing costs for private educational services are under close scrutiny by the General Assembly. In the past few years, they've instituted a rate increase cap from year to year. But the real dilemma is that the cost is driven by the greater and greater number of children, particularly those children identified with autism as their primary disability, who are being placed by the local schools into private placements through the special education process. I think you'll be seeing some additional interest by the General Assembly in this. The Joint Legislative Audit and Review Committee, JLARC, is just wrapping up a study of CSA, which includes a particular focus on this area. And that report will be released mid-November. On the next slide, what you see is, it's a busy slide, but what you see is where the foster care money is going over the last 4 years. And what I really want to point out is that the largest costs in foster care, and accounting for 45% of the overall expenditures in foster, that you saw on the previous slide, are for those therapeutic or treatment foster care programs, which, as Andy and Nannette spoke about, are those provided by private agencies, in which, in addition to the basic foster care maintenance costs that would be accrued by a child in an agency or family foster home, the CSA also funds what we refer to as support, supervision, and administration, which is a payment to the providers to recruit and support those placements, and often can weigh in north of $100 a day. So the shortfall in family foster care is that diligent recruitment efforts that you heard about from the DSS folks are so critical, not only because of any benefit to the child, but if those children can be served through agency-funded foster homes as opposed to private foster homes, a large proportion of the CSA costs could be averted. On my last 2 slides, and I'll take one, okay, I think we're good on time. I wanted to close with 2 slides which highlight the important ways in which the CSA is interwoven with our partners at the state and local departments of social services. First, children receiving foster care services are required to be served through the CSA. This is not, anything that anyone has any option over. And the funding for those services are, as I described, have to be sufficient to meet their needs. Secondly, with the exception of certain federally funded maintenance costs referred to as Title IV-E, that about 58% of foster children are eligible for, which cover their maintenance costs, not any additional service costs, not TFC, support, supervision, and administration, all services for foster children other than the 4E maintenance, as well as the until the implementation of the Family First Prevention Services Act. The prevention of, so it's foster care, and the prevention of foster care must be addressed through the local CSA processes of the FAPT and the CPMT. So CSA and DSS are quite closely tied together at the local level. Next, we mutually support each other's statutory and regulatory requirements, so we work with one voice, and that the rules that apply to CSA are the same rules that apply to children in foster care. And finally, on an ongoing basis, changes in child welfare policy and practice, like the Family First Prevention Services Act, which Nannette told you about, have a direct impact on CSA. And we work extremely closely with our colleagues on this panel to ensure coordinated efforts. Before I close, I had meant to, a bit earlier, ask Andy and/or Rebecca to just briefly speak about it, and I still think there's time because I only have one more slide, to speak about their experience with the FAPT and the CPMT in particular at the local level. So I apologize for sliding past that, but it's never too late, Andy.
I'll let Rebecca give an example.
All right. So I just wanted to let everyone know that even though CPMT is pretty much a mandated part of the responsibility of not only social services, but every county and school system statewide, we have used in many localities the CPMT process to jointly work on other projects beyond just the approval of funding. And so it really gives human services agencies in a community the opportunity to sit together and focus on the needs of the community. We do community needs assessments, and we work on projects beyond just funding. Our CPMT in Middlesex County has actually been working for the past couple of years on trying to get a private day school to come to the region. The closest one that serves children with autism is approximately an hour and a half away. So our kids are driving to and from school up to 3 or 4 hours a day just to access those services that they need. And so that's just one small example. We also have on our CPMT not only human services agencies, but county governments. So our CPMT has a board of supervisors representative. And I think sometimes just sitting on CPMT gives perspective into the human services world that local governments otherwise would not have.
Thank you so much, Rebecca. Did you have anything else? You look like you were stopping, so I'm not sure.
I am finished. Thank you, Scott.
Okay. So I really appreciate that, because it really highlights that the CSA program and the CPMT are not just a place to drain your coffers. But I know, Lee, it seems that way. But to provide a gathering place that's established and required by the code that really doesn't exist for the child serving agencies, for the local government folks to come and sit together to talk about the needs of the children and families in your communities, and to assess those needs, to develop plans that may go outside of what the CSA can do. So to really serve as kind of the central hub of planning and collaboration around children's services across agencies, across branches of government. And so I really appreciate how Rebecca has highlighted that for me. So I'll finish with my last slide, which kind of takes me back to the beginning. At the core, our common ground is rooted in our shared beliefs. The CSA mission, and I've highlighted, you heard me speak about it earlier, a child-centered, family-focused, and community-based system. And the practice model that DSS and many other child-serving agencies accept as their own is family, child, and youth-driven practice, and a system that is family-focused, child-centered, and community-based. Boy, those words look the same on both sides. So we share this commitment between DSS and CSA to family and child and youth-centered practice, a community-based system of care, emphasizing the safety, permanency, and well-being of children receiving foster care services, as well as the others that we serve, and which strive for the best possible outcomes for the children and families we all responsibly are responsible for together. They are our community's children. They are not DSS's children. They're not CSA's children. They're not only the school's children. They are our community's children. And so this coherence of mission helps us get where we need to get with as little friction as possible. So I'll stop here. As with anyone else, I will be happy to take questions either now or sent in later. Katie can forward them to me, and we will be sure to get responses to those of you. And thanks again for spending some time with us this afternoon.
Well, I'd like to thank you, Nannette, Andy, Scott, Rebecca, for taking the time to give us all this information. It's a little bit like a fire hose, but I've got a few questions. I'll spend a little time writing them up, because I think I can do a better job of expressing them. Katie, I would like to make sure that I get a link to this, because I would like to make this available to our local social service board. I think it's a great piece of information for them, so they understand a little bit better. We've done a little bit of that kind of training locally, but I think this is a great example of how we can let people know what's going on. Does anybody else, any other committee members have any questions they'd like to bring up at this time?
Lee, this is Scott again. I would like to offer, and I have done this on a number of occasions, because it is complicated, to visit with your board of supervisors, whether in person or like this, and I could, depending on the time, break down your local program a little bit, although many of you have very competent local folks who can do that. But if you're interested in the state perspective, I'm happy to come visit with you. So I'm just going to leave that offer out there for anybody on the committee or anybody else in county government.
Well, I think that I'm fortunate that my supervisors, my fellow supervisors at Orange County, do not give me a lot of grief on this, since I'm the guy that tends to connect with the social services aspects of our county, and I don't get too much grief on this. So I think I think people understand what it's for and why it's necessary, and they understand the problems associated with the opioid addiction and everything else that's exacerbating this problem. Anybody else have any questions? Again, thank you all for taking your time to present this information. I got a chance to look at the slides in advance, and so I think I was able to follow you a little bit better. But this has been a great effort. And again, I guess we can close down. Katie, do you have a connection for this on a YouTube video, or however you're going to promote it?
Yes, absolutely. We're recording it, and I'll work with Gage Harder to make the recording available. So thank you, and my thanks to the panelists, and also wanted to give a shout out to M. Parente as well, who I know was involved in putting the slides together. So
Before
thank
we
you all.
close, I do have one question for Nannette. This is Elijah Johnson. When is the information going to come out about Family First and the change that you mentioned in reference to the shift in funding?
Em, would you like to address that? Thank you for that question.
Can you hear me okay?
Yes.
So the Family First Prevention Services Act has to be implemented by October 2021 according to the federal law. So we had anticipated that we would implement earlier because in October 2020, because we really want to take advantage of the funding for prevention services. So we have done a lot of work to try to reduce our dependence on congregate care and to work with community service providers to make sure that the kinds of services that we can use federal funding to pay for are going to be available at the point that we make the transition. But as you can imagine, COVID has significantly disrupted a lot of our planning and our efforts to move forward. And the funding that we are going to require, the state funding to match the federal funding to pay for prevention services, was frozen in the state budget and will now not be available. So we have delayed implementation with the federal government. We've let them know we need a delay in Virginia. The question at this point really is, how long will we delay? And we are currently in conversation with the governor's office and the state budget people to figure out at what point we think the money will be back in the state budget so that we can fully take advantage of the prevention services. But bottom line is, unless something changes at the federal government, the absolute latest that we could implement would be October 2021.
Thank you, Em.
And then one follow-up, do we have a list of certified providers? I know that was an issue at one point. Have we got any leeway, any headway on that?
Are you talking about residential or prevention providers?
Prevention.
Information about prevention providers is available on the Virginia Family First website. I will, as soon as I stop talking, I will see if I can get that link into the chat for you.
Thank you.
Thank you. Thank you, Em.
Are there any other questions? Any other comments? Again, I'd like to thank you all for taking your time to give us this information. It's been a useful afternoon, even if it is approaching cocktail time. See, the nice thing at home, you can have your cocktail sitting right alongside as long as you shield it when you drink.
Have a good weekend, everyone.
You too. Thank you.
All right, bye now.